How to use a defibrillator. If you find someone unconscious, unresponsive and not breathing, they are having a cardiac arrest. To give them the best chance of surviving, you need to call 999 and start CPR immediately. Unfortunately, CPR alone isn't always enough. If an abnormal heart rhythm has caused the heart to stop pumping blood effectively, they may need the help of a defibrillator. This is how they work. If you think there's a risk of infection, use a towel or a piece of clothing and lay it over their mouth and nose. Turn the defibrillator on and wait for the voice commands to start.
Follow the voice prompt calmly.
Continue to give compression-only CPR whilst this is happening.
Take out the pads from the bottom of the device. Look closely at the picture on each pad.
Carefully attach the pads to the casualty exactly as shown in the diagram on each pad.
Peel off the pads labelled 2 and stick to the bare skin of the patient.
Once both pads are in place, the defibrillator will ask you to move clear of the casualty so that it can read the casualty's heart rhythm to see if a shock is required. If a shock is required, it will ask you to ensure everyone is clear of the casualty before asking you to press the shock button.
Press the flashing orange button now.
CPR will then need to be continued when the defibrillator instructs you.
Begin CPR now.
Most defibrillators will talk you through the steps of CPR, or will give you the option of hearing CPR instructions by pressing a button. The defibrillator will reanalyze the casualty's heart rhythm to determine if a shock is required every 2 minutes. Keep the pads attached to the casualty and follow the defibrillator's instructions until the emergency services arrive or the casualty regains consciousness.